Yeah, I guess we can just get started. I don't know. So firstly, I think, a big proportion of the attendees at this conference are actually from hospitals, which is great. I started my career in, how do I present here? I started my career at Toronto Rehab, which I'll explain in just a sec. Yeah, so about me, I started my career in Toronto Rehab. I was a SARS screener. I couldn't find another job, so the only thing I could do was I worked at Toronto Rehab at 5 in the morning. I had the gloves and the gown and the goggles and everything, and I was taking people's temperature and asking them if they'd been to Hong Kong. And it was probably the worst job I ever had. But it led to one of the best jobs I ever had, because after SARS ended, and I had done marketing communications in school, I realized there was a marketing department, and I didn't understand why in Canada, given that we have public health care, why there'd be marketing in hospitals. So I went and had a conversation with the VP, and she ended up, offering me a job, and it was great. And so I got, this amazing experience. It was right after Toronto Rehab amalgamated on five or six different rehab hospitals. So it's such a diverse array of sort of healthcare, areas and there was a teaching hospital of Toronto Rehab, of U of T. So got lots of experience with research and everything. So that was a great start to my healthcare career. So when I was traveling the world, after I had left Toronto Rehab, I ended up in the Middle East, and my friends said, were telling me Dubai's booming, you should check it out. And so I ended up getting a job at Toronto Rehab, TBWA. Not enough coffee this morning. TBWA, which is an global advertising agency, and they hired me to lead their communication. I've never worked in an agency, and they hired me to lead their communications around healthcare and build their healthcare portfolio. So I did that and ended up building it into the largest healthcare consultancy in the Middle East and Africa. And then, met my wife there, had a child, decided that let's move to Asia. So then I moved to Singapore, where I was hired by Edelman, and I was leading the healthcare sector for Southeast Asia at the beginning, and then I grew that to Asia Pacific. By the end, I wasn't doing healthcare anymore specifically. I was in charge of all of the major sector businesses, but it was still, amazing experience. But then it was like time to leave, and so we headed back home to Canada, and I started my current company, which is called the Brightburst Collective. And what happened was, along the way, as I was kind of taking on these jobs, I was new to freelancing, and I was taking on these jobs, and clients would ask me like, "Hey, can you help me launch a new yeast product in Japan?" And I'm not someone who likes to say no to clients, so I'm like, yeah, sure, I can help with that. And had to go find and curate sort of this team around that job specifically. And what was great was that at the end, we found out that, not only was the client super happy, but the consultants were really happy, because as freelancers, you kind of work in isolation, and you kind of do what you're good at, but you're kind of only doing that one thing over and over again for clients. This was an opportunity for everyone to kind of sort of tap into a more multidisciplinary team and to learn from each other and to kind of create something bigger than ourselves. And so I realized, there's maybe something here. Maybe the agency of the future actually could look more like a group of consultants coming together and sort of cherry picking the right teams around jobs, rather than whoever's sitting in, the agency office. And if any of you work with agencies, there's a lot of frustrations, I think, and a lot of hidden costs and stuff like that. And we're able to kind of do with all of those things. So yeah, it's been fairly successful. I've been going at it that around 20 years now. So I just wanted to give you guys that context, because when I was asked to share my experience, I realized that my experience in Canada, it's been a while that I've lived here, and I don't have a lot of specific experience. So I wanted to kind of share with you guys some of the things that I learned as I was traveling the world and doing healthcare, because maybe there's some ways that I can, help inspire what you're doing. There's probably a lot of similarities, but there's probably some really interesting sort of things as well that hopefully you guys can come away with. So please let me know if there's anything that anything that you want to ask me. And I'm sure a lot of you have a lot of global experience too. I'd love to hear your perspectives on that. So got a few lessons, a few stories I want to tell. This is really high level, but I promise you I'll try to get a little bit deeper. But one of the things that obviously I learned along the way is that, everyone's different. Everyone is, people are unique, every single one of us. But at the same time, we're all really pretty much the same, and it doesn't matter your culture or where you're from. There are certain things about human beings that really, makes us all similar. And so, what I wanted to demonstrate was how you can tap into that dichotomy, and how you can really sort of, if that's all you know about your audience, or if that's really what you want to tap into from an insight, you can actually do quite a lot. And then the third one is really that people are just generally messy, and that you can't always get it right, but there's a lot of lessons to learn along the way. So the first thing I wanted to do was share, when I was in the Middle East, first of all, the first week I got there, I was thrown into a crisis. So Wyeth Pharmaceuticals, which is, was purchased by Pfizer, they had Centrum vitamins. And the first week I got there, I was pulled into the CEO's office, and there was a crisis because I guess someone had learned that the capsules were made with porcine, and in the Middle East, where, Muslim countries, the fact that, people didn't understand what that meant really, and they weren't sure it was haram. And so it just kind of blew up, and it was such a crazy day, or crazy couple of weeks actually. But, once that settled down and I started to kind of get my feet wet, one of the things I ended up learning was that there are more witch doctors than there are psychiatrists in the Middle East per capita. And, and so for my client at the time was AstraZeneca. They were trying to build sort of a portfolio around mental health. And in the Middle East, we were learning that people were more likely to be locked up in their basements or to be beaten if they had certain mental health issues, rather than seek, the appropriate help. So, that there was a huge job to be done. And so what I'm showing you here is just how different people within the Middle East, these are both doctors in the Gulf, and one's obviously, depending on who you are, you have a different sort of background, you have a different sort of expectation for what you want in your healthcare. And you can get, I'll show you an example, really amazing healthcare out there, but you can also get some really, let's call it like spiritual kind of health that maybe isn't based so much in science. And so, not to say that it's wrong, it's just different, right? And so you have to really learn about how to balance all of these things. So what we ended up doing was, these few psychiatrists that existed, they also hated each other. They were super competitive, as we all know, working, I think, with medical experts, sometimes egos can get quite big. Well, when you're one of only 5 psychiatrists in a whole region, you can imagine that you're pretty competitive with your other psychiatrists. But we were able to bring them all together. We worked with the government. We had a big public affairs activation as well, where we brought the government together. We had to do so much education around, with the government, with the medical experts also, but then also with schools. And so we were able to kind of convene these groups and bring everyone together, and we created the first mental health society for the Gulf. And so GCC is, Qatar, Saudi, United Arab Emirates, Bahrain, Oman. So yeah, it was the first one. It was the first one in the region. And what was great was that, I mean, the idea about how people are different. I think these people, people that were suffering from mental health in the Middle East, they really felt different, and and to the point where the stigma was it was life-threatening for them, because they could be locked up in a basement, or they could be chained to a wall, essentially, in some of these places. And so what we really needed to do is we needed to allow people to kind of just speak out about it, and just kind of cut through all of that, and just allow people to feel like, look, it's okay to be depressed. It's okay to, these things. And I know in in Canada, we're our health literacy is quite more advanced, I think, in some ways, and we're much more open about speaking about these things. But it wasn't too long ago that we weren't as well, and there is still a lot of stigma in these areas. So it was really a really interesting kind of thing to tap into this idea of, okay, well, we need to honor and feel like these people are. It's okay to be different, but at the same time, we needed to kind of bring people together and make them feel like, look, we're all the same. So again, playing off of this idea of differences and similarities, to kind of balance out, how do we create the right kinds of communities to raise awareness and to, create change in the marketplace around that. Another huge project I worked on in the Middle East was this hospital. So it's called Sidra Medical and Research Center, and it's a teaching hospital. It's I guess one of the most advanced sort of women and children's hospital in the world. And it took 2 years pitching this to finally get it, and it was a crazy experience. But when we finally won it, we had a huge job to be done, because now they were building this gorgeous hospital. I mean, it's essentially the experience. I think, again, one of the things that the differences that I really found in the Middle East were that, like, the way that people wanted to experience healthcare was more. It made a lot of sense, actually. They wanted to experience healthcare more like it was. It didn't have to be clinical and cold and scary. They wanted it to feel like a hotel. They wanted it to feel like high class and engaging, and sort of have experiences that were positive, and not necessarily just a factory. And so, but we had to hire, I don't know how many, hundreds of medical experts from around the world to come work at this hospital. And we had to convince people to come to Qatar. And if anyone's ever been to Doha, there's stuff to do, but I mean, it's not always the easiest sell. And so again, thinking about how people are all different, and we really had to identify and understand what was different about the experts that we were hiring and that we were targeting. And so if you're, a pediatrics sort of expert, but you're coming from one part of the world versus another part of the world, well, how do you target that? How do you understand that? And so we really had to go deep into classifying and understanding. And this was probably before, the digital targeting really became sort of more mainstream. So we were some of the first to kind of really go in and create these sort of pull messages that, rather than targeting people through LinkedIn or targeting people through their sort of medical expert channels, we were targeting them through Facebook, and we were sort of using these pull methods to kind of get them to be like, oh, I never considered working there before, because we really had to overcome that barrier. And it worked great. And what we ended up finding was that despite all of the differences around the world between, like doctors, especially, the one thing that they all really are attracted to was golf. And so we were able to, the messages that worked the best for us were to show how many golf courses were in the region and how accessible they were, and how by, 2 o'clock in the afternoon, they could already be out on the golf course. And that really worked really well for us to attract the right kinds of people. Then after moving to Singapore, again, one of the ways that you can really tap into the idea that people are all different, but they're also all the same, is leveraging data. And I know this is, again, something that is maybe a bit more understood now, but at the time that we were launching what was the Inner Age Index in Asia for GSK, that we didn't have AI, we didn't have all that sort of stuff. So we had to do surveys kind of the old-fashioned way, but we did them in such a way, and we did them with media partners in the region, so that we were able to amplify as much as possible this idea. But when you create the feedback loop, right, and you're able to play back to people how they're different, and so similar to Canadians who were always comparing ourselves to Americans, in Singapore, they're always comparing themselves to Malaysia, and Malaysians are comparing themselves to Thais, and Thais are comparing themselves to Indonesians. And so we were able to kind of, do these surveys and kind of identify and asking people, how old do you feel? And by all of these different metrics, we're able to create what we called an inner age. And this inner age was a number that then people, we could say, well, the inner age in Singapore was actually 5 years younger, based on people's health and the way that they behaved. But in Malaysia, it was only 3 years younger. And so there was like bragging rights, and we created this sort of perfect storm of conversations around this idea of inner age. The other thing to mention too is the reason we were tapping into this conversation around age is because in Asia, much like the rest of the world, but really in Asia, it's accelerating, is the aging population and all of the health issues that kind of are coming about because of that. And so GSK, their consumer health, they have everything from like denture care, and they have like, pain medicines and things like that. And so we were able to kind of create these stories based on all of this data that we had collected that was able to kind of tap in and target these specific, for these specific brands as well. We ended up having big events all over, and we invited all the aunties and uncles, like who, we had these guys, you can see the pictures, playing table tennis. They were part of this really big group in Singapore of older people that were active and out there. And so it was a really great conversation to shift it away from, the government actually was very happy to help promote this too, because we were shifting the conversation away from the negative aspects of aging, and everyone was talking doom and gloom and Alzheimer's and all of this stuff. And we were shifting it towards a much more positive conversation about how do you age well, and how do you, and we were able to put numbers to it too. So I think that's really what allowed us to kind of be successful for that. Now, the other thing that is kind of like a human truth is about how people are different and the same, I think, is the idea that we're very attracted to this concept of otherness, of seeing people that are, live a life that is quite different than our own, but at the same time that have something about them that resonates very personally with us too. And so when I was working with Boston Scientific, we were identifying, people that had really severe asthma for a product called bronchial thermoplasty that they had. And we ended up landing on Yu Guang, who is this man here. He's a Buddhist monk. He has severe asthma. But if you can imagine, he lives in a monastery, and every day he's got to climb like tons and tons of stairs. He's breathing in incense all day long. He has to chant. And if you have severe asthma, these things are hard, and he's dedicated his life to this. So it's not like he can just kind of, call in sick one day. Like, it's like, this is his lifestyle, but he's got severe asthma, and they're competing with each other. And so there's a really rich story that we really wanted to tell. And so we created a whole video series around him and a few other people that have severe asthma, and talked about and showed their progress through the treatment, and showed how they were able to kind of live the life they wanted to. But I guess what I'm really trying to explain here is that, like, healthcare is such, for me, it's the reason I've always loved healthcare, even though it wasn't something I studied, or it was really because there is probably no other area where you can, that is so personal. Every single person's experience for healthcare is different and unique, but then at the same time, it's so universal, where we can empathize and we can really understand and feel for other people in similar situations. And so this is, a way that we were able to kind of tell these unique stories. And being out in Asia and in the Middle East and around the world, with sort of eyes that I think you kind of become, when you stay in one place, you kind of become blind, I think, to the great stories that are around you, because they kind of normalize. I think when you kind of are putting yourself into a new areas, all of a sudden everything's really new. And so you're looking at something that people have been looking at. And so, there's Buddhist monks all over the place. But when I was looking at it, I was like, this is a story. And so I think bringing in that perspective and being able to see things and having different people kind of come in and look at the stories that you have to tell, I think is a great way to sort of unlock the potential of storytelling, in terms of that dichotomy of what makes us the same and what makes us different. So as I started to kind of move into more, bigger global campaigns, one of the, I needed to, I guess AstraZeneca had turned down Pfizer they wanted to purchase AstraZeneca and they turned them down, and they had this oncology pipeline, but AstraZeneca wasn't really known for oncology. And so they had to recruit, I don't know how many people around the world. And so we were tapped to do an employee value proposition and kind of a recruitment campaign for the cancer experts for pharmaceuticals and you know, with different medical backgrounds and researchers and everything. But we needed to create something that was able to, that had to work. So, you know, had to accept the fact that there was different kinds of experts based in South America versus Asia versus Russia versus Middle East and Africa. And so we need to create a global campaign that was going to equally attract people from all over the world. And that was a huge challenge. And what we ended up realizing was that it doesn't matter where you're from or you know, how long you've been in the field. If you're working in cancer, you know, like in any capacity, you know, I always say even Mick Jagger wakes up in the morning sometimes and is like, oh, I've got to go back to work again today. You know, everyone eventually starts to kind of get into the mundane part of their job. But when we work in healthcare, you know, there's this underlying tension where it's like, if we can remember what we got into it in the first place, and bring that back, I think you can tap into sort of this visceral need that everyone has to want to kind of make a difference in their work. And so we landed on this idea of make life your legacy. And what was interesting was that we rather than using imagery, because images are hard, you know, you can't, a person who looks Asian isn't going to work in South America and vice versa. And so we ended up kind of coming up with this graphic where it's instantly recognizable as a cancer cell. But then when you look closer, you can see on the outside of the cell, it's all of the patients and it's all of the people that make up all the cilia. And then inside is actually all of the medical experts. And so it's sort of like from the inside out, you know, you can make a difference and you can make life your legacy. And so this ended up going all over the world. AstraZeneca ended up, you know, having amazing success hiring, you know, oncology experts from around the world. And they ended up using it, I think, for the US eventually as well. And so it was just an example of sort of how there are human truths, there are these things that we can find and tap into that really allow us to be able to target and customize the messages in a way that allows us to kind of hone in on individual experiences, but that still has this sort of unifying message. And then lastly, I wanted to talk about, again, you know, how humans are messy. And so when I worked in Toronto rehab, I was introduced to this concept through, I think, the nursing leadership they had there around multidisciplinary teams. And I love the concept of, like, I didn't understand why it was such a revolutionary thing, but to put the patient at the center of care and then have all of these experts from various backgrounds, even things like palliative, you know, people that represented sort of the religions of those people, like their spiritual people, their family members, you know, bringing all of these different people to customize their care around the needs of the patient, to me felt like, wow, that's the way it should be. And when I started working and creating Bright Birch, I realized, you know, that's also how I think clients want to work with their agencies, right? It's not about who's available at the moment to work on my team. It's, you know, you go into the pitch. For anyone that's experienced this, I've done a pitch with an agency, right? And there's all these senior people and you're like, wow, these people are great. And then when you win the business, you end up putting all your junior people on the account. And so clients kind of don't like that. They didn't like all the hidden fees and things like that. And so we were able to really tap into this idea of multidisciplinary teams. And sort of, I was thinking about what I learned at Toronto Rehab, where it's like, well, how do we bring the right kinds of people? And again, people that are the same. So if you want people from your industry, especially healthcare, right? You want people that really understand the industry, but then at the same time, it's nice to have a couple people that don't understand the industry, that kind of come from outside, that bring this creativity to the table. And so that's how we've sort of, you know, brought this idea of diversity around our clients and right sizing the team. So it's not, there's, you know, you only pay for what you need. And it doesn't always work. I realized that, where people are messy, it's like not everyone knows how to work in teams very well. Not everyone has the personality type. And so there's a lot of learnings as we're going along. But when it does work, what we realized is the power of perspective that comes from having people from various backgrounds and different ideas is really unlocks the potential of those teams. And I think the whole becomes bigger than the parts in a lot of ways. And so yeah, so we're still kind of starting out, but we're learning a lot. And that's sort of what I wanted to share. So yeah, that's pretty much it. I think the last thing is that, regardless of how different we are, how much the same we are, how messy we are as humans, really people are amazing. And that's probably the overarching message that I've learned through my time traveling the world. But yeah, just in terms of, recapping what we learned, it's really about, how can you create communities that appreciates people's differences, but then also brings them together in the ways that they're the same. How do you target messages at people using sort of these nuances and what makes them different? How do you use data to kind of gamify the differences and get people to play off each other and sort of compete, but at the same time, in a way, play the messages back to them so that they don't feel, that they can feel like they're kind of normal and really, how we're all the same. How do you tell stories that balances this otherness, but also with the recognizable parts of ourselves? And then how do you find the human truth that gets to that core idea, but then that can be sort of leveraged in specific ways at specific audiences. So, and then lastly, how do you, within your own teams, how do you leverage the power of diversity of people and people's uniqueness? Because I think there's a huge movement, rightfully so, towards diversity, but a lot of people are looking at it as a tick box exercise. And for me, I think diversity is a strategic lever that we need to be pulling, because it's more than just making sure that you have the right number of different types of people around the table. It's really about, all of these people have different experiences. How do we really tap into those experiences and make sure that we're thinking and looking at things from so many different angles that we can mitigate risk and that we can sort of unlock opportunities?